He's a 71-year-old male patient with uncontrolled diabetes and a prior history of cancer, specifically a lymphoma. And he showed up in my clinic a week ago or so with the complaint that he had been having a fever for 2 weeks associated with the severe dry cough and general malaise. So he received an influenza test. First thing you think of is not really coronavirus, because influenza right now is much more common in the island and also in the mainland United States. So we did an influenza test, which was negative. So the next thing I did was order a CT scan of the chest. Actually, I did a chest X-ray, a plain chest X-ray that was negative. But to detect coronavirus, actually the CT chest is much more effective than a plain chest film. And the CT scan of the chest showed multiple areas with what are called ground glass opacities, which is a typical finding of coronavirus. So when I saw that, I immediately thought that the patient could have coronavirus. We asked him about the contacts with other possible infected patients, particularly from the U.S., because we now know that it is in the general community in the U.S. He had not traveled to China or to any of the endemic areas like Italy. So I thought maybe he got it from someone that had traveled from the U.S., but he also denied any contacts, recent contacts from anyone who had traveled. His daughter and his grandson also had what was thought to be a common cold. The only thing in his history that was positive. So we contacted the Department of Health so that they could run a PCR test for coronavirus. He met all the criteria that the CDC has some requirements that the patients should meet before they get tested, and he actually met all the criteria. So when I called them, I thought they were going to do the test, but they refused to do it. So that was someone from the hospital that contacted them, a nurse, which is kind of the usual procedure. So when he told me that they had refused to do it, I couldn't believe it. So I asked him, who do you talk to? And he gave me the name of the person. So I contacted that person in the Department of Health, and she told me that the reason was that she talked to her boss, who's the state epidemiologist that works at the Department of Health. And I asked her what was the reason. So she told me that the patient had a history of having been in contact with his daughter, who had the common cold, and that was the explanation why he had this problem. And I couldn't believe what she was telling me. I told her, look, this is absolutely insane. I mean, this patient doesn't have a common cold. He has a very serious illness. He's got pneumonia, and he also has a typical picture, and is negative for influenza, and he's almost about to be intubated. He's in an intensive care unit. This is not a common cold. So then she told me, let me talk to my boss. And then she called me back and said that she had talked to her boss, who's a state epidemiologist, and that was their explanation. I said, no, that cannot be. So I said, I cannot just stay here and not do anything. So I grabbed the phone and called the CDC offices in Atlanta, Georgia, and I explained the case to the person that I finally got to. It's a physician, very nice person, and I explained to him the whole picture, and he acted, like he couldn't actually believe what I was telling him. I mean, he didn't tell me that outright, but you could tell by the way he was talking that he couldn't believe that they refused to do it. So he told me that definitely the patient met all the CDC criteria to be tested. So I told him, well, I don't know what's going on, but I think there's some problem here in Puerto Rico because they refused to do other cases or to do all the PCR testing in other cases also. So he told me, let me call her and I'll call you. I'll let you know. So he called her, and a few hours later she called me the person here in the state health department called me back. I happen to know her actually, and she told me that the the reason that she wouldn't order is because she was afraid that if she sent several cases that were negative, and that then they wouldn't be responding to her requests in the future because she was ordering unnecessary PCR tests. So I told her, look, it doesn't make sense. If you're following the recommendations, the CDC recommendations, I don't see why they would refuse to do your test. So that's the last thing. Then after that, I talked to her again because she told me she would call me the next day, and she didn't call me back. So I called her back, and she said then that she was going to look at the results that of the blood cultures and other tests that we had done to rule out other possibilities like Legionnaire's disease, for example, uh, or just a common pneumonia, like pneumococcus or chlamydia or other pneumonias like mycoplasma pneumonia. And if they were negative, then she might do the test. So that's where we stand right now. She told me she'll do it.
Have those tests been done?
They've been done.
And he was negative for that?
The ones that they have come back already are negative. The blood cultures were negative. Legionnaire's was negative also. We're
What
waiting
about
for micro. Sorry?
mycoplasma? Because mycoplasma has been an issue on the island, right?
Yes, absolutely. So that's pending also. But anyway, I don't think that this is a mycoplasma pneumonia. It's not the typical picture. I mean, the patient didn't have the usual symptoms that are associated with mycoplasma, including sore throat. He didn't have that. And his chest CT appearance is not that of mycoplasma either. So I doubt that's going to be positive, but we'll
How
find
is
out.
the gentleman tonight?
Sorry?
How is the man right now?
He's stable. He's in high flow oxygen, but he's holding his own. He has not had to be intubated. He's not getting better. He's not getting worse. So he's stable. But the thing is, that it doesn't matter if mycoplasma is positive or negative. The CDC does not require that we do a mycoplasma test. The only thing that they required is to have an influenza test that is negative, or to rule out any other obvious source of infection. But right now, the CDC has liberalized the criteria. They don't even require what they required before. Now, if the clinician who's taking care of the patient feels that the patient has a typical case of coronavirus, that's enough for them to run the test. So she doesn't really have to go through all these difficulties.
Doctor, your patient needs to be tested. And the reason I wanted to interview you tonight is I've been very careful not to include any stories that come from anyone, secondhand rumor, and especially someone who is not a medical provider. But when you reached out to me and I verified who you were and you told me the story of your patient, I wanted people to hear from you because that man, two things, that man needs to be tested. And second, medical providers like yourself are the ones who should be deciding when